I have a problem with connectivity. Yes. Admit all. Admit all. Admit all. There are challenges of connectivity from here. But I think now it's okay. I've changed my position. I think now this should give us better connectivity. Okay, 10. Okay. So welcome back to this session. As I say, the connectivity is not very consistent as it has been in the past. So, but we'll try our best. So kindly mute yourselves. Could I mute yourself? I can see you have not muted yourself. Tesema is trying to join us. He's saying that he has problem with connectivity. I hope he can eventually sort out that issue and be able to join us. So we have left by saying that moment by moment, the therapist confirms the child's experience, and this witnessing fosters the child's trust in what she herself feels and perceives, and leading to her or to his evolving a more genuine self, a keystone to psychological health. Remember, when you're talking of the genuine self, and not only for kids, but even when it comes to the adult therapy, that evolving to the genuine self is very important. Or if you may use the language of Carol Rogers, that differentiation between the organism and the self that brings about the self-actualizations in the teaching of Carol Rogers. Now, let's go on in this presentation. We are still presenting on how the play therapy from this approach works. I see somebody here was chatting. What is it? Okay, one more chat. Okay, so most of all, the therapist empathically listens and Janet responds to the child, and the play then allows the child to put her conflict or his conflict into a symbolic arena, and this teaching is by Ilvin. And what does that mean? A child who feels unable to confront, for example, her alcoholic mother, can confront a doll standing in for her mother. And this is a technique actually that Anna Freud taught, and it's called the technique or the defense mechanism of displacement. And we see this not only in children, but also with adults. When, for example, a secretary is so much annoyed by her boss, knowing that she may not be able to confront the boss, you may find, a secretary just leaving the door of the boss and not, and banging the door. The door is innocent. The door has not done anything wrong. Or, for example, a mother who has been angered by the husband, and because she's not able to direct the anger to the husband, she directs that anger to the child. That is called displacement. So what we are saying here is a child who feels unable to confront, for example, her alcoholic mother, can confront a doll, and by confronting a doll, then the child is actually learning how to manage her or his anger, even if it is not directed to the object, or what we call balloons of anger. You're going to, I'm sure you have already seen that in the article that I asked you to summarize. One of those 15 play techniques are the balloons, the balloons of anger, where a child is asked to blow into a balloon and then burst that balloon as a way of letting out of the repressed anger. So that girl can speak her mind and even take a revenge without feeling a reprisal, because she is actually dealing with a doll, and through the doll then transferring that anger into the doll. Now, the child also can project intolerable feelings about herself, putting in what we are calling internal conflict on the outside. Putting the internal conflicts on the outside. Let me see, somebody wants to be admitted. Dotono, Samuel Dotono. Okay. Two chats. What are these chats about? Good morning, class. I am struggling for connection. That is Abutam. Okay. So the child can also project, we are saying, intolerable feelings about him or herself. That is putting internal conflict on the outside, making it a concrete reality she can wrestle with more comfortably. And you can read more on this from Jacobson's work, 1954. Now, at its most basic, psychoanalytic play, like most play, permits the child a forum in which she or he can face herself, her conflict, and the people in his or her life from a psychologically or psychologically safer distance, hence more fully and openly. And we are going to see this when we watch the video on the play itself. Now, let's ask ourselves a fundamental question. Now, what is the role of the therapist? Or what does the therapist do in a play therapy? Now, in no mode of treatment is the role of the therapist more entwined with the basic theory and construct. In many ways, the therapist and her way of being is the intervention. The therapist and the way of being is the intervention. Remember, I have told you, we are the number we are. You are the number you are in class, 12, according to what I see here in the participants, 12 of you. Now, the kind of therapist you become is not just through the training that you're going through or the skills that you're learning in this course and indeed in other courses, but your person, the kind of person you are, introverted or extroverted, those enduring characteristics of yourself as a person, enduring unique characteristics that are both internal and external, that make you who you are, that actually brings your haters, your uniqueness. That is what more than anything else determines the kind of therapist you are. Techniques, of course, are important, but they build on the person whom you are. And therefore, the way you present yourself to your child, the way to the child that you're dealing with in therapy, the more the child develops trust in you and the more effective or the more efficacious your intervention will be. So as with any relationship-based therapy, this is a summary of what I've said, the therapist strives to create an atmosphere of safety. The therapist tries to create an atmosphere of acceptance and of genuine positive regard for the child. It is like Carol Rogers who is talking, creating that unconditional positive regard for the child. And when the child feels that he or she is accepted unconditionally by the therapist, then that actually increases trust in the child and embellishes, of course, the therapy. Now, our empathic, look at this, at the choice of words, our empathic and inquisitive posture toward the child. Remember, when you're talking of empathy, you're talking of allowing yourself to enter into the perspective of the child or to enter into the world of the child. Put it in a more layman's language, putting yourself in the shoes of the child. Her experience and her self-expressions are very, very essential. And therefore, empathy. Remember, one of the virtues and values of therapies is that of empathy, more than any other else. That helps you to enter into, of course, the worldview of the child. And once the child sees there is that a harmony between you and the child, then therapy is embellished. bringing one's child to a therapist is not easy and can represent a most loving and courageous act. Why are we saying this? We are saying this because there are still some people, many people, or many families that are not open to counseling because of the connotations, the connotations that go with it. Why are these parents taking their child for therapy? It is most, the stereotype mind on some of the families will be, is because they have failed in their parenting roles. And therefore, some couples will not allow to be known that they're taking their child for therapy. And we need to overcome this because now psychology or psychological interventions these days are as important as any other intervention when a child needs help. Like, for example, seeing a doctor. I saw this actually in Italy. That there are three important personalities in the life of an Italian. One, of course, is a medical doctor, that a family is attached to a medical doctor who deals with organic diseases, but also to a psychologist. As the role of a psychologist stroke counselor is very, very important, and the families will be attached also to a counselor, but of course also a spiritual leader, a priest, or in a spiritual leader. These three personalities are important, and you can see why. Because when you're talking of a medical doctor, he is the one who will be dealing, of course, he will be dealing with the biosocial, in the three paradigms, or in the three domains that we're dealing with. It is the medical doctor who will be actually dealing with the biosocial development of the child, the priest with the spiritual, which touches the psychosocial aspect, and of course the psychologist who will be merging the three: biosocial, cognitive, and the psychosocial. So admitting that your child is hurting or needs professional help is painful and can threaten your self-esteem as a parent, especially as a mother. But it is vital, it is important that once you discover that your child needs professional help, that you need to come out of that, cocoon of feeling threatened and actually be daring enough to offer your child that help. So even when parents bring a child to therapy because a school or some other agencies pushed for it, we should give them credit for doing so. We should give them credit for doing so because they have seen that your child has a need, and that need ought to be assumed or taken care of without feeling guilty of having failed in parenting. And that is why actually, when we were discussing the counseling of minors, we did say that it is important when it comes to the counseling of minors that we are talking of the balancing of the social systems. That is a state, the parent and the minor, himself or herself. Therefore, after you have done that, then you look at the rights of the minor, but also the responsibility that goes with the parent stroke guardian. Now, the more we can involve the parents in the treatment, the better the treatment works. And we already said it when we have looked at the counseling of minors. Most children are happy when they know that an adult is following the interventions that they are getting. So much so that they feel actually supported in the therapy itself. And that leads to more openness. And of course, that openness and trust leads to a more refined therapy. And therefore, it is important that you, the parents, are involved in the treatment of children. We need the parents' cooperation to get the child to us, meeting after meeting, and to do so and to do the business of therapy. This is just re-emphasizing what I have already said. So parents are a primary source of information about the child and the home. So parents can tell us their perceptions of the child's behaviors at home, how he gets along with siblings or peers, and how he does in a school. Remember, while confidentiality is one of those things that we have to keep and to observe in our interventions, remember when you're dealing with a child, early childhood, the child has not developed enough cognition to be able to be left by himself or herself. And therefore, you as a parent, remember one of the things that you're called to do as a parent is to promote the welfare of your child. And not only the welfare in terms of making sure that the child is healthy, but also you are the one who is going to pay for the fees that for the fee that is required for the intervention. And therefore, it is important, it is vital that the parents are involved in therapy sessions of the child. And when the child sees this, it actually helped the child to open up even more. While the child's therapist empathizes with the parents' difficulties, parenting a particular child, he doesn't ignore parental irresponsibility, failures, or shortcoming. And this is important because the child may be in the situation in which he or she is because of the irresponsibility of the parent or for conflicting situations that are in a family. Remember, one of the things we said in terms of rights of children is that children must never be used as scapegoats. They must never be used as scapegoats. And therefore, in a situation like this, then, it is important that the parents are not just pushing their kids for therapy or treatment while the problem itself is with the parent. And you as a therapist then, you are the one who's called to discern that, so much so that the parents do not actually become the obstacle of therapy in overemphasizing what actually is not the problem at hand. So if parents act or speak in ways that thwarts their child's growth or that somehow sidetrack his or her development, they need to know or they need to be told. And the one to tell them is you, the therapist or the counselor. So that comes or brings us to the end of this particular presentation on the psychoanalytic approach to therapy. Remember, as we have said, let me stop sharing the slides. I come back to class. The most important thing that we are emphasizing here is on the importance of dealing with the unconscious, the unconscious aspect of a child, or to help the unconsciousness of a child to come to consciousness. And how do you bring the unconsciousness of a child to consciousness? Is by the play, by the play therapy. And with the play techniques, with the exercise that I have given you to focus on the different play techniques, you will realize that most of these techniques are supposed, to bring, those repressed emotions like anger to be expressed. Like I have said already, the balloons of anger. And of course, you have those other techniques that you are summarizing on. Remember, the assignment is to be presented in the next Friday. Now, do we have any questions on that before I present the second file now on this, again, on play therapy, but from a broader perspective now, not just psychoanalysis, before we go now to watch, before we watch some of these plays. Any questions, comments, or anything that you have from this file that we have just completed presenting? I can see you, Peter, there. Yes, your webcam is on, and Agnes Munuve. All the other webcams are not showing. Yes, Tesema, I can see now that you are connected with us. Your connectivity now is okay? Okay. So, any questions that you might have? Otherwise, I will present the second file on play therapy from a broader perspective. Okay.